Good morning and welcome to your manual handling training. I'm Jenny Murphy, the manual handling trainer for SASH. Today we're going to talk about slide sheets. Slide sheets we use in order to effect an easy move around a bed or another surface, whether up and down or laterally. The reasons that we use this is that these are very low friction, which means that it's ease of use. So it makes life easier for the staff to start to move patients around the bed, and also it helps to prevent some pressure damage from moving the patients around the bed. These slide sheets are single patient use, and that means that we can use this multiple times for the same patient, but only for that one patient. So the idea is that if somebody comes into ED with mobility restrictions, they would get a slide sheet as soon as they got here to effect any transfers that they needed. That same slide sheet would then go up onto the ward if they were admitted and would be used for the transfers up there, because you can use them multiple times. Please also remember that if your patient on your ward needs to go somewhere like X-ray or MRI, to send this slide sheet with them, because they will still have mobility restrictions when they go to another department in the hospital. This particular slide sheet is the size of a single bed, and that's because it's really important that the entire patient is on this, from the tip of the toes right to the top of the head, because that way all of the bony areas of the patient is on there, which will help minimise that pressure damage. And this slide sheet goes directly under the patient. It does not go under the sheet, because if you did that, that would mean that you were then using the sheet to effect the transfer. So it goes directly underneath the patient. We're going to show you two different techniques to actually insert the slide sheet. One will involve rolling the patient, and the other will involve unravelling the slide sheet underneath the patient. So we're just going to demonstrate that to you. Again, it's really important that you communicate with your patient exactly what you're doing. So tell them who you are, tell them what you want to do and what their part in it is, if anything at all. So what we're going to do this time is that we're going to roll the patient away from me towards Priscilla and then put the slide sheet in underneath. So as we've done before, we're going to bend the patient's leg, ensuring that the foot is flat on the bed. We're going to ask the patient to look in that direction, move the hands slightly away from the body so they don't roll on it, and then put the patient's hand across their body. Priscilla is then going to put one hand across on the hips and the other hand on the shoulder, and I'm going to match the same, and we're going to use that same weight transfer technique. We're going to go on the command ready, steady, go, okay? Ready, steady, go. And again, Priscilla's going to support him inside lying. We now open up our slide sheet. It's a tubular slide sheet. It doesn't matter which way out it is because it's slippery all the way around it. So with this edge level with the edge of the bed and ensuring that it goes all the way down to the feet, we're going to just tuck the other edge of the slide sheet gently underneath the patient and then roll them back. Ready, steady, go. And we're now going to roll the patient in the opposite direction. At this point, it's really important then when Priscilla bends this knee that the foot is not on the slide sheet, because if the patient tries to help and their foot is on the slide sheet, they risk slipping and injuring themselves. Ready, steady. Ready, steady. So as you can see, the slide sheet is directly under the patient and covers both the head all the way down to the feet. So we can now begin our manoeuvres. Today what we've discovered is that our patient has got too far up the bed, so we're going to manoeuvre them down the bed. So Priscilla and I will face each other at about torso height of the patient. Lift up the top sheet and take a good grip level with the patient's hips and the patient's shoulders. Your hands should be in close to the patient. We adopt a hip width, nice wide step stance, and because we're transferring the patient down the bed, we should have our weight on the head end foot. That way, when we use the commands ready, steady, slide, we're going to weight transfer downwards, and that will affect the slide down the bed. Ready, steady, slide. So these are incredibly slippery, so you need to go really slowly with them, and they make your job an awful lot easier. If we're now transferring the patient up the bed, please under no account tilt the head of the bed down, because what happens is when you get gravity involved in a transfer and you're using a slide sheet, the patient will go far too fast, and then you risk the patient going too fast and hitting their head and injuring themselves. So to come back up the bed, this time we'll have our weight on the feet and leg, and the manoeuvre will be a weight transfer towards the top of the bed. Ready, steady, slide. If we wanted to go across the bed, this time we adjust our step into a step stance. And if we were going towards Priscilla, Priscilla would take hold of the sheet at hip and shoulder again. And what she does is that she weight transfers backwards and acts as a brake to stop the patient going too far across the bed. I'm responsible for the power of this manoeuvre because I'm going to be pushing, which is much more effective than pulling. So I'm going to lift the top sheet and put my hand flat on the hip and flat on the shoulder. And then on the commands ready, steady, slide, we're going to effect the manoeuvre. Ready, steady, slide. We're then going to bring him back into the centre of the bed, and this time we swap our grip, so Priscilla is now going to be pushing and she's going to give the commands. Ready, steady. In order to take the slide sheet out, we can use two methods. We can either roll the patient as we did before, in which case we would roll the patient, tuck the slide sheet up underneath them, roll them back, and then take it out that way. Or there is a natural gap that occurs underneath the patient's knees when they're lying flat. So if you lift the slide sheet at one side, put your hand through to the other side and grab the bottom slide sheet, and then in a diagonal upward movement, keep pulling the bottom slide sheet like this. What that does is it brings the slide sheet from under the patient by sliding it against itself. If you have a really, really large patient or someone that is unable to roll for whatever reason, it's going to be really difficult to put the slide sheet in that way. So we're now going to show a technique called the unravelling method. So if your patient can tolerate it, have the slide sheet on top of them. And then what we're going to do is that we're going to make a fold in the slide sheet, like that, pull it slightly towards us, and then keep folding the slide sheet all the way down to the bottom. And then when we get to the bottom, we're going to turn the slide sheet completely over. Go up to the top of the bed, and then there is a natural gap that occurs behind the patient's neck when they're lying down. So we're going to feed this slide sheet underneath the neck by pushing down into the mattress and sliding it in. So make sure that you've got equally the same amount of slide sheet either way, but it covers to the top of your patient's head and it's just tucked underneath the patient's shoulders. Now, both members of staff now face the top end of the bed in a step stance position with your outer leg forward and your inner leg backwards. With your outer hand, so my right and Priscilla's left, you take hold of the open end of the slide sheet and hold it down against the bed. With your other hand, palm flat and facing upwards, you go underneath the whole of the slide sheet and grab the top of the fold, like that. And then on the command ready, steady, slide, we weight transfer backwards, and as we do so, this starts to unravel our sheet underneath our patient. you say ready, steady, go, on ready, make sure your partner is ready to go. Okay? Ready, steady, go. 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 So that's a method of getting the slide sheets in underneath your patient if they're very large or not able to roll. Thank you.